Welcome viewers of D Life once again to this D Life channel. Again, we bring information about real food, low carb diet, ketogenic diet, and how it is able to help reverse a lot of diseases, a lot of disease like metabolic syndrome, etc., etc. Welcome again. And today we have a special guest. We have Dr. Pran Yoganathan from Sydney, Australia. I'll just give a brief about Dr. Pran. So before this, first of all, a declaration of conflict of interest or disclaimer. So there are no financial involved in anything. So I am a volunteer of D Life, and it is an honor for me. Thank you, D Life, for giving me an opportunity to host this show. And not there are any financial involved with Dr. Pran also. So with this, I'm going to introduce Dr. Pran Yoganathan, word to word verbatim, so that I don't miss out any of the details. So Dr. Pran Yoganathan is the director of the Center of Gastrointestinal Health, Sydney, Australia. He is an accomplished and highly experienced endoscopist and expertise in quality colonoscopy. Dr. Yoganathan is a strong advocate for preventive health care using nutritional and lifestyle approaches to modify health outcome in his patient. Special interests include quality diagnostic and therapeutic endoscopy, bowel cancer screening, the role of diet in the disease of gastrointestinal tract, and the role of diet in non-alcoholic fatty liver diet, fatty liver disease, NAFLD, or commonly known as fatty liver. I take pride in welcoming Dr. Pran Yoganathan. Welcome, doctor.
Thank you, Sashi. It's a pleasure to be here with you today. Thank you.
So, doctor, like we have been, we find that you are sharing a lot of things about real food, the impact of the modern processed food, the modern processed oils and everything in causing metabolic syndrome. So, can you just, briefly tell us about yourself, what exactly you do, and, how come you came into this, this real food diet? Yes, doctor.
No problem, Sashi. Look, I've been a specialist now for the last 10 years and a doctor for the last 20. From my perspective, I've been simply overwhelmed with the burden of illness society faces. I look at the trajectory, and I'm staggered by the burden of illness, and I just don't see how this is all sustainable. So I guess a few years ago, I decided that I was going to pursue a method of management or medicine which looked or focused on preventative healthcare, incorporating nutrition and exercise and sort of counseling people through it. Look, it's been a fantastic journey from me perspectively, because from my perspective, because it's been able to help a lot of people gain some quality and length of life, I think, back. And look, I feel that there is certainly a need for this type of medicine in the future. And personally, from my perspective, I've had a lot of family history of diabetes, I've seen my father go through the current treatment paradigm with the insulins and the oral hypoglycemics, the statins and whatnot. And I watched my grandmother pass from diabetes-related complications last year, and really felt like perhaps all this could have been avoided. A quality of life towards the end could have been avoided. So this has motivated me to seek a different way to practice healthcare.
So that's really great to hear. And can you just tell us, about something, how this modern processed food, how it is affecting us? Why is suddenly metabolic syndrome increasing, and specifically with focus to, of your specialization of area of interest about gastrointestinal disorders? Fatty liver is, something which is exploding across the world. And, so what exactly is it? Why is it happening suddenly?
Okay, no problems. I'll answer the first of your three questions, which is why is all this becoming a sudden problem? I think the answer to that is multi-layered, but in essence, we've gone through a period where we've eaten real food for millions of years, and then with the advent of agriculture in the last few thousand years, certainly the nature of our food changed. But I think in the last 50 years, we've seen industrialization on a scale that is unprecedented in order to cope with the population that continues to explode globally. So at the moment, we're just in an environment which is extremely confusing. It's a food environment where there's significant forces in terms of marketing. There are guidelines that tell people to eat a certain way, and economic constraints, which I think limit a person's ability to eat appropriately. So in essence, what I feel to encompass it all, I think the human body really needs quality protein, and you know, whether that's animal or plant-based, animal protein being far superior. And essentially we're being starved of that. And if a creature, and I've spoken and posted multiple times on protein leverage hypothesis, because I think that is the underlying basis behind why we've got illness or obesity and metabolic syndrome, is that if we cannot reach a protein target for a day, as a mammal or as a human being, we are driven not through a lack of willpower, but driven through just this constant need to seek out energy. So protein deprivation requires a human to seek out energy. But the problem in this modern environment in the last 50, 60 years is just so much cheap, refined energy in terms of cheap carbohydrate type energies in refined sugar. So we're just constantly consuming this. And in addition, you throw in fructose, especially through its modality as high fructose corn syrup or sucrose, then you've really got a recipe for disaster with regards to insulin resistance. So, I mean, you can see that globally as these rates just continue to climb. A lot of these, to encompass it and summarize it, is driven by a form of protein deprivation. I posted on this yesterday. I'm not sure if you've seen it, but the problem we've got in continents like Asia and Africa is that these continents which are more dependent, or countries which are more dependent on plant-based protein, unfortunately they're getting the raw end of the deal, because just through modern crop production and through rising CO2 levels in the atmosphere, the plants are less nutritious. There is less protein, there's less calcium, less zinc, less magnesium, and so again, it's a form of nutrient deprivation, and the brain senses that. You know, the very ancient sort of satiety centers in our midbrain that senses nutrient deprivation, and we then have to seek out energy, and which is what we're constantly doing. And of course, we don't have the exercise levels to burn off this energy. Henceforth, we store this as fat. So this is the crux of the modern day obesity / diabetes problem. And the second part to your question is, like, how does this tie in with my specialty? Well, the thing I see a lot of is fatty liver, which is essentially fat deposition or triglyceride deposition within the liver. A lot of it's driven by exactly these things that I'm talking about: energy excess and a place to store the energy. The liver acts as sort of the first port of call. Once you put food in your gut, the liver has to process all that, and it's generally the first place where energy is stored, and then the body distributes to other parts of the body. And the other aspect we see as gastroenterologists is just a lot of gastroesophageal reflux, abdominal bloating, irritable bowel, all this tied in with this concept of with metabolic syndrome, just a gut struggling to deal with this type of this nutrient / energy delivery that we're providing it. So that was very strong factor for me to want to explore managing things through nutrition. And the interesting thing is, that people do get very good results through modifying diet, as you may have seen from what you guys do as well.
That's true. In fact, I used to suffer a lot of belching, bloating, gas, acidity, and I always used to have a strip of antacid in my pocket wherever I go. So something which I disposed of almost 4.5 years ago. I don't need antacid anymore. No more bloating, gas, belching. So so probably all this refined food. Uh, and as you say, the general protein content of Indian diet is very, very less. And we are dependent more on excess carbohydrate, wrong type of fat. And, all this gets fermented, GI tract, and then, they cause a lot of issues. And something
Yeah.
about, about this, the sales of antacids or PPIs are very high. So,
Yeah.
how exactly
Yeah.
do these proton pump inhibitor drugs, do they really work? How is it? I mean, does it address
Well,
root cause?
no, it really doesn't, because generally as a person ages, their stomachs actually become far less acidic, yet paradoxically they get more reflux. I've often said that reflux actually is not a disease of acid, it's primarily a disease of muscle. We've got a muscle system known as the lower esophageal sphincter, which essentially holds the acid into the stomach, stops it leaking back, and surrounding that we've got the diaphragmatic orifice through which the esophagus enters, which also acts as a mechanism to hold acidic contents within the stomach. But as a person ages, as the person becomes protein depleted, these muscles age as well. They become less effective. And what we've got with reflux is essentially inability to hold the acid within the stomach in the stomach contents, because acidic stomach is a prerequisite to digestion. We need it, and we are evolved to require it. So the proton pump inhibitors don't address the root cause, because all they do is reduce the acid further. And yes, it may alleviate symptoms, but you're possibly interfering with digestion. And it makes sense why osteoporosis and various other issues, such as Alzheimer's disease has been linked with these proton pump inhibitors. Whilst I don't think they're directly causative, I think there's certainly correlation which ties in with nutrition.
So for anyone suffering from these acid refluxes, how do you see, there are many around here who've been taking antacids and PPF for quite long. So how do you think,
Yes.
what could be a simple solution for them to, get this resolved at the root cause level?
Look, as you know, lifestyle changes are never simple initially in terms of making that step. But if a person was motivated enough, I think the way you'd explain it to them is fermentation. Chronic fermentation of food drives transient lower esophageal sphincter relaxation. In addition, foods that are very, very rich in non-absorbable carbohydrates, our breads, our garlics, our leeks, our onions, cereals, grains, rices. These contain a sugar called a fructan, and fructan's potent in terms of what it does to the proximal large colon. It ferments, and there's just accumulation of the sugar through the course of the day and over a course of a week, and people just fermenting away. And this chronic fermentation drives reflux, again, through muscle rather than actual acid itself. So, the one way is to get rid of the fermentable carbohydrates from one's diet, or minimize it at the very least. And secondly, I think eating a diet that's very, very rich in protein is just going to drive better muscle health, whether it's the diaphragm or lower esophageal sphincter. I think the diaphragm is critical to keep healthy. But what we're seeing now as people age is just progressively sarcopenic diaphragms, the diaphragm's thinning out, which drives the stomach to rise up into the thoracic cavity, which is called a hiatus hernia. Some people can get enormous hiatus hernias, and these are all multifactorial things that are driving gastroesophageal reflux. So, I mean, you can see to improve that, there has to be dietary changes, which is very, very difficult. It's very difficult to regain diaphragmatic strength as well. I mean, people talk about breathing exercises and things like that, but I'm not sure if there's any firm data for it. So I think arresting the damage is the best way to play it to reduce chances of further damage. And finally, just in terms of visceral or midline obesity, the fat carried within the gut tends to exert a lot of pressure on the stomach as well. There's increased intragastric pressure driving acid back. So yet another mechanism through which metabolic syndrome or visceral adiposity, intra-abdominal fat basically drives gastroesophageal reflux, multi-layered, multifactorial.
I think, yeah, as you say, the midsection, the tummy, this is something which is very, very common in India. And we are all basically what we call as lean people, tofu, thin outside and fat inside. And we collect all our energy, all the fat in the midsection. And so many of us would appear very lean, but have a tummy bulging. So, what you're telling is essentially, so this is also one of the positive factors for this reflux. And,
absolutely. As you said, Southeast Asia, Asia in general, and in fact, it's the same with Africans and Aboriginals. The races that were perhaps the last to adopt agriculture, and in addition, that did not evolve in really cold climates where fat was a prerequisite for energy conservation. I mean, as you may know, in a cold environment, one needs to burn energy to stay warm. Now, a person can expend up to 4,000 calories in a day simply just trying to keep warm in a very, very we're talking sub-zero temperatures. So the ability to store fat in Northern European or European populations, especially outside the abdomen, as an insulation and an energy mechanism was an adaptive thing. Whereas in some of these other countries where it's hotter climates, there's no requirement to store this fat in an extra visceral sense. So the storage is all within, which is a horrible thing because it drives insulin resistance very, very quickly as fat deposits within the organ system. This is why here in Australia, it's really quite evident, like very obvious. You will see people of a Caucasian background or Northern European background, obviously that is the majority of the population here, whilst they can put on weight, their sugars may not move. And that doesn't apply to everyone, but most of them, the sugars will not move, whereas you get a person of Asian or African descent, just a slight amount of fat and their sugars shoot up and they become insulin resistant quickly. This is known as the personal fat threshold, and certain races certainly it's quite dramatic how diabetic they can become with very little body fat, obvious body fat. So that little belly that's being carried, as you said, by most Southeast Asian or Indians, it's very, very it's hugely problematic.
This fatty liver thing, this NAFLD, NASH, NASH, it is exploding like wildfire in India. In fact, this is something which I keep sharing with all my podcast guests. In fact, there was a study done in Mumbai where I stay by one of the hospitals, Nair Hospital, and they actually found that most of the kids, school-going kids in the affluent part of Mumbai, they actually have fatty liver. In fact, they found some of them even having fibrosis. I mean, this is just terrible. What could be the future? And probably what they also found out this most of these kids are all snacking those these burgers and pizzas and all those sugary Coke and everything, all the sugar-sweetened beverage. So I hope that we as parents, we also come to senses and at least have a bright future for the kids. It's really terrible, which we see. Fine.
Yeah,
so Dr.
yeah.
Yeah. So also tell us, how about this, incidence of you, since you're also an expert in colonoscopy, how about this cancers and everything? How strong is it increasing? How strong is it associated with diet, or is it genetic? How is it?
Well, again, many factors to it. Everything it's a lot of disease, or the ability to actually physically manifest a disease such as cancer. You need to have a genetic predisposition. It's the same with diabetes. It's the same with autoimmunity. There has to be a genetic predisposition, but environment often is the thing that comes along. So I describe genetics as a loaded gun. Environment is the hand that sort of pulls the trigger to create disease. So cancer, there is often genetic predisposition. However, in saying that, obesity is a major driving factor for all of this. Insulin, as we know, is a potent growth factor, and if your insulin's up, it generally implies that your carbohydrate intake is quite high. So you've got a potent mix of a growth factor as well as circulating sugar, which, as you know, is a terrible combination to have. And in addition to all these reactive oxidation species, which is being driven by things like vegetable oils and high carbohydrate based diets, there's just chronic damage, chronic oxidative damage to our DNA, which unfortunately the body struggles to mop up. There's just so many errors within this DNA. The body can't mop everything up, because you got to realize, in any healthy human, there is, at any given time, there is always cancer cells. It's just the body's immune system recognizes it, picks it up, cleans up the error. Whereas if you've got a human who's riddled with errors everywhere because there's just so much damage going in, well, you're just increasing your probability of developing a cancer. And that is why obesity and the cancer sort of epidemics, you could plot them basically virtually on the same graph, and the curve would look identical.
Fine. So, I mean, it is, as you rightly say, each one of us have a certain genetic predisposition for certain disorders, maybe metabolic syndrome, diabetes, hypertension, heart disease, cancer, Alzheimer, or Parkinson. So probably,
yes.
As you say, the trigger lies somewhere in the environment. What pulls it? That is something which we all need to understand and know that the food could be that trigger. So having wrong kind of food, which will actually set forth this disease. So like we say that down here in India or in the subcontinent also, so we are all genetically disposed towards having diabetes, and for the matter even heart disease. So maybe 70-80% of our diet actually comes from carbohydrate. Much of them would be refined carbohydrate, and there is a recent trend towards going away from the traditional fats and oils towards all this refined oil. Do you think this could also be one of the triggering factor, especially in this subcontinent?
With the fats and oils?
With these oils, I mean these refined oils.
Yeah.
We are using all this canola oil or all this soybean oil, refined palm oil.
Well,
I mean, that is a big factor in India.
Huge problem. I mean, huge problem. These are very omega-6 rich mediators, and as you know, these tend to drive an inflammatory pathway within the body. I mean, certainly we need some omega-6 for sure in our diet. The body can't synthesize it, and it keeps the immune system healthy, but this is a complete overload of omega-6. Very little omega-3 going in, which is the anti-inflammatory pathway of the body, but a massive imbalance in the omega-6 content. And of course, it's found in huge amounts in plant-based fat, which is what all vegetable oils are to some degree. In addition, these oils tend to have a very low burn point, henceforth you're just oxidizing them very quickly. So it's a complete mess. If you can think of it that way, it's a double whammy, really. Oxidized omega-6. Couldn't think of anything worse to put into our system. As we moved away from the traditional fats that we used to cook with, things like butter and ghee, and embrace these plant-based fats because they're supposedly healthy. This is the problem. But we know that these things are commercially produced The production process of how they get from plant to vegetable oil, it's a chemical process requiring multiple chemical steps, and the amount of solvents and so forth that are added, and the heating that's done, it cannot be good for you. But it's cheap and accessible, and this is what's being promoted. And unfortunately, I think it is a major problem, and I think it's something that we need to work with to try and get out of our diet.
So, the subcontinent, so whether it is India or neighboring Pakistan or Sri Lanka, so this is something which is exploding. All this, not only this GI issue, but even the whole metabolic syndrome is actually exploding. And probably we have also gone away from our traditional diet. The traditional method of cooking is different, and the influx of this refined, bleached plant oils, plus all the modern day processed food and everything. Yeah. So the other factor is, the other thing which is conflicting is, does a non-vegetarian food cause cancer? Let us say meat, fish, egg, or any other non-veg. Do they really cause cancer, like colon cancer? How is it? Because there are some conflicting studies are there, and generally people are afraid that these are not healthy. So can you throw some light on this? Is it a fact, or is it just a sort of theory or some misconception?
No, there's a lot of misconceptions, a lot of poor data out there, and unfortunately, the World Health Organization have put in this, this possibility that red meat causes cancer, bacon causes cancer, processed meat causes cancer. It kind of is based on a lot of weak data. So this is the problem that we've got. It's epidemiological data based on food frequency questionnaires, and they definitely cherry pick the data. So it's a problem. So I don't think we can say meat causes cancer, and certainly in a lot of these studies that are being done, comparing meat eaters versus vegetarians, they find that meat eaters tend to get all sorts of disease, heart disease, diabetes, more of it, but again based on poor quality epidemiology. In addition, in the modern environment, it's important to realize that most meat is consumed in a terrible way. Along with other things like burgers, chips, especially in the West here. I mean, it's burgers, chips, and I'm sure it's similar in subcontinental India, subcontinental nations where it's mixed in with rolls, and it's carbohydrate. It's soaked in vegetable oil. There's a ton of potato. You know what I mean. And it's sort of it's always consumed with this type of stuff. So what we find is meat eaters generally, when you compare them to vegetarians, if they're eating in a standard way, of course the vegetarian diet's going to look better because the protein's just being consumed in an abysmal fashion. So I think we have to be careful saying meat or fish causes cancer, because I mean, we've eaten these things for millions of years. For at least 3 million years, 4 million years. And certainly cancer would have been a very rare event in those in these people. And certainly extrapolating, looking at hunter-gatherers that go on to live 70 to 80 years of age, cancer is a very rare event. These people generally die of infection. The extremes of life, either young or old. They don't tend to die of these illnesses that we're dying of, which is cancer, heart disease, Alzheimer's, and cancer. So I think, despite having a very animal protein-rich diet, so I think we have to be very cautious in making that assumption that meat causes cancer. I don't think it does, but the way we consume meat in the modern world is hugely problematic.
I think, as you say, in the subcontinent, so I will say that whether it is vegetarian food or non-vegetarian food, most of the food can be actually toxic simply because of the refined flours which are used and the kind of seed oils are used. In India, and probably this is true in the subcontinent also, that many of us may not realize this. We know this, but we don't realize this, that most of the oils which are used commercially out in the sweet meat shops or snack makers, they're actually reused oil, reused oil.
Oh, yeah, 100%, yeah.
And they never change that oil. And I always say that if that shop claims that I'm here for last 20 years serving humanity, then let me tell you that in that vessel, you will find an oil which will date back to 20 years. Because
that's a good point. Yeah, it's a great
he
point.
will, he will just empty out that oil in some vessel, clean out that frying pan, and then they will put back that oil again. Uh, in
Yeah,
fact,
yeah.
uh, if you go out and net, you will see that there is a large market for for purchasing reused oil.
Wow.
In fact, the top snack makers in India, they use the oil for few times, and then they sell it off to some local snack makers, or they even auction it off actually. So it is without realizing, we go only by the taste. Okay, this snack is tasty, and this snack is hygiene. These are the two things we see. Okay, it may be hygiene and it is tasty, yes, but is it healthy? I think we need to ask ourselves that what I am having, is it healthy or not? So this is a sad question.
That's
And
a very sad question. Yeah.
traditionally, if you really see, if I talk of India, so we used to consume all this fried stuff only certain seasons. Like the winter season coming in. That is when all the festivals come in, and then the rest of the time we will not have. But now there is a perpetual snacking, perpetual feast is something which is happening. And I
Yeah.
remember
Yeah.
in my childhood, I
It's,
used to have, yeah, doctor. So in my childhood, I used to have, let us say, potato wafers, once in a while, maybe once in 6 months or so. But now we have it every day. It is available at only 5 rupees or 10 rupees a packet.
yeah.
Snack like anything.
That's right. Commercially produced on a large scale, and sadly the potatoes depleted of any nutrients. As I said, it's the carbohydrate to nutrient ratio is extremely high. So again, it's just more energy from a depleted, unfortunately, a very depleted vegetable, which it's all about economies of scale, and unfortunately, the compromise is the nutrient quality. And it's quite sad because remember, what we were talking about earlier, if that protein quantity is not met by the body, constantly craving it, and this is why these people just keep continuing to snack. It's not a willpower thing. There's food's always been readily available in places like India and wherever. Food's always been readily available. Why is it that we're snacking now? Are we suddenly gluttonous? Are we suddenly turning into these people that have no self-control? It's not the case. It is simply driven by a very deep physiological, centrally mediated, and right here, centrally mediated desire to want to seek out energy. We are being undernourished, systemically being undernourished. And it's sad to see. And we put it down to willpower. Well, it's not willpower. It's more than that.
So, explaining this protein leverage hypothesis, as you have been telling simply, so how it translates to us Indians is we keep on eating a lot of carbohydrate stuff, and the desire to eat more is increasing, and the appetite and hunger is also more. So probably we are seeking that protein, that minerals, that micronutrients, and which we are not able to get in adequate quantity. So hence we eat more. So probably with another factor coming in this, the excess insulin which is being released due to this refined carbohydrate, and also the consequent insulin resistance caused by maybe excess fructose or excess vegetable oil, I'll say rather. So all this would be big issue. So
Yes.
so can you throw some light on probably how fructose causes fatty liver? So that is of area of your interest. So can we have fruit, or is it fructose in some form? Is it from this cold drinks, or is it from this processed food? How is fructose from fruits safe? So can you just throw some light on this?
Well, it needs to be looked at in the individual. So if the person's metabolically unwell, if they've got insulin resistance, obesity, fatty liver, well, fructose does nothing to help. I mean, having an apple might be a better idea than having Coca-Cola, which has multiples above. But say you were to have 3 apples, you've already satisfied the amount of fructose that is in the Coca-Cola, in the high fructose corn syrup in the form of corn sugar. So it's all about, well, does the fructose serve a purpose in that person? No, it doesn't. Does the apple serve a purpose in that person? Perhaps. There's some fiber, which, we know fiber is relatively overrated in terms of in the low carbohydrate space. Now there's some vitamin C, but there's better ways to achieve those things. We can get it out of our green vegetables, which are low in fructose. The problem with fructose is it has to convert to fat. It has to be turned into triglyceride and stored as energy. So essentially what happens, the liver becomes fattier and fattier with all this fructose that's being delivered. And it's important to note that even our white sugar or sugar in general has fructose. 50% of that is fructose along with glucose, and that's what sucrose is. So we're just being completely assaulted at multiple levels with fructose. The fructose loading in a human being over a course of time is enormous. So this is the issue. Whereas if you're someone who's metabolically healthy, I mean, you can enjoy fruit for the pleasure that it gives, for some of the micronutrients that's available. But for someone who's metabolically unwell, who's trying to fix their lives, I would say that there's better ways to obtain your vitamin C and fiber. I'd obtain it from above ground vegetables, far more nutritious, far less in the way of sugar. And it's important to remember that fruits come with not just the fructose, but the sucrose as well. There's always sucrose in fruit. And so there's just too much sugar within these things. And it's important to know that we've selectively bred them. Things that were tiny, we've now selectively bred into for portion size and taste. So it was never part of an ancestral diet in the doses that we're consuming it at. So if you're fit, healthy, enjoy fruit once in a while. If you're unfit, trying to sort your life and your diabetes and obesity out, it's a silly idea to consume fruit from my perspective.
Yeah, that way, if you see, earlier we used to have fruits only in certain season, which is grown locally. So now there is a perpetual supply. We can get it anywhere. We can get even apples from anywhere. We can get dragon fruit from anywhere. We can get kiwi fruits here. So something which is available, 365 days a year, and then we are not restricted to that brief 3, 4, 5 months where we used to have, or 2, 3 months.
Absolutely. Food out of season due to globalization is one of the biggest issues we've got, fruit in particular. Yes, I agree.
And, the other sad part is, a lot of people, they just guzzle a can of Coke or a bottle of Coke multiple times a day, or even, let us say, even once a day. And then, they will see it something, as quenching their taste. So, that is how the advertisement goes. Probably simple plain water will suffice, or even maybe, let us say, a lemon juice, with salt. Is something far more nutritious. Or in case of India, I will always say that, a glass of buttermilk.
Yes.
Far more nutritious, of course.
Yes. But unfortunately, it's just, again, that buttermilk will be far harder to find. Whereas these things are easily accessible. It's important to remember this poor person is just trying to seek out energy. That's because they're protein deprived, and the buttermilk's not readily available, nor is it as cheap, probably. So it's that access to that cheap, refined energy that is the major problem.
Sometimes, I'm also surprised to see when I go to, these shopping centers, malls, and then we see family buying Cokes in tons, multiple cans, a month supply is being actually, for the regular consumption. So, these are the things which actually can be avoided. At home, consuming a can of Coke at home is, something which is, actually, I'll say it is almost criminal, when we have an option of at least having lemon juice or buttermilk at home. So sadly, that is how it is. So, so how do you think, this subcontinent, this India or subcontinent can actually improve their health, improve their GI health and overall metabolic health? What do you feel is, few simple messages you think will be
Yeah,
useful?
sure. Look, with regards to, you spoke about, well, from a cultural perspective, there's a culturally appropriate diet. What would be interesting to know is what the Indians pre-dating culture, what was it like before the advent of agriculture, 3,000-4,000 years ago? As we know, India is a very diverse country made up of many types of different types of humans and various races that entered India. So it's a beautifully diverse country. And with them came different types of foods, but there was a species of human that existed in India before all this occurred, and these people were primarily hunters, hunter-gatherers, and I know that they still exist in remote areas in India now, although they're probably now subject to westernization as well, or certainly being brought into the modern world. But we know that a lot of ideology drives this method of eating in India, where primarily we've got the world's biggest population of vegetarians, something like 30 to 40% from memory, and even the 60% that do consume meat, it's a very limited part of their diet. So the problem is, Shasi, where you start mixing ideology with something like nutritional science, you've really got an issue there, and that's kind of at the heart, the way I see it, of where India's issues are with diet, and that's difficult to remedy. I'm certainly, as a Hindu by birth, and my parents are still practicing Hindus. I wouldn't say that I'm a practicing Hindu because I eat anything and everything. I've had to re-look at the ideology. It's kind of like, well, do I want what's best for my health, or am I going to follow this pathway? And that's a personal journey everyone's got to take, and I'm always careful to respect that. But I think one of the key things with our people, Sri Lankans, Indians, Pakistanis, Bangladeshi, whatever, is that the reliance on plant-based protein is hugely problematic, and I think is unfortunately doomed to fail. And I think the introduction of animal-based foods like milk and eggs, at the very least, are critical. We know that because of modern agriculture, these plants are being systematically being stripped of protein in these nutrient-poor soils. So people are just not going to get their nutrient requirement. And I think a lot of these tables and that look at, well, how much protein is in a bag of lentils, that these things no longer stand accurate in the modern world. I'd love to know whether these things are still accurate compared to 20 years ago. I think the protein content in these foods are steadily dropping, and that is a problem. There is a set point of protein to achieve, and the best way you could do it is with animal-based foods. Eggs in particular, I would be encouraging people to increase that, not worry about should there be a limit on how many eggs I eat. I mean, there are days I will eat 20 eggs with very little concern. It's whatever is needed to make me satisfied and to make me reach my protein target for the day. So that's kind of what it's at, where it's at. I think people should be tracking the protein. They shouldn't be tracking calories, but should be tracking their protein daily and saying, am I meeting that? Am I meeting that protein requirement? So that's the advice I'd be giving. And if they're reliant on plant-based protein, well, I'd be asking them to supplement it with a quality whey protein or something like that, a milk-based protein, because you just struggle otherwise. And in addition, if you're consuming a lot of plant-based foods to reach your protein target, well, you're taking in more carbohydrate anyway, because all plants at their core are a carbohydrate, which might offset what you're trying to do for your insulin resistance, because we really want to keep our carbohydrates low, protein high, fats moderate. So that's what I think.
So, for our audiences, to translate this simply, we will have to actually increase our protein, and everything depends upon what we believe and even what our religion is. For all
Yeah.
non-vegetarians, it is very easy. They can increase all their non-vegetarian food very easy and add up some lot of vegetables we have in our country. Yes. For vegetarians, yes, we have options. We can have a lot of paneer, and we can have a lot of yogurt or curd, what we call as curds or yogurt. We can have cheese. These are all first class protein, and those are not able to meet match up. So as you say, it's very easy to have a scoop of whey protein. Absolutely, there is no issue. Please avoid all those plant protein made of soy powder. Absolutely
waste of time.
They're all processed and highly toxic, I will say. And the best way is, yes, the only processed protein which we can very safely take is whey protein. Absolutely, there is no need to be afraid. And so these are the various protein options we have for vegetarians. So all is not lost. The other major factor which this community needs to do, especially in the subcontinent, is get away from all these refined oils which is available.
Absolutely,
getting off this refined oil, reduce all
cooking in ghee. Ghee is the best stuff. Best stuff you can cook in.
Ghee, makhan, butter. We call them makhan in India. Ghee, makhan are absolutely safe. And don't be afraid of all this cholesterol business. Absolutely.
I agree.
And eggs form one of the cheapest food here. It costs only 5 rupees, 5 to 6 rupees on an average, depending upon season. One of the cheapest food, and which even many vegetarians also don't mind taking. And let me tell you, it is one of the best, one of the high biological value food which is available and available throughout the year. And please go ahead and have, add as many eggs you want. There is no limit. Even I take 6 to 8 to 10 per day. Don't worry. My cholesterol level is absolutely normal, and it is very, very safe. And increasing, as Dr. Pran has said, increase the protein, we will find that the overall the necessity to eat more carbohydrate actually comes down. So if someone is having, let us say, 4 roti in a meal, they can as well lop off 2 and then add 1 egg, add some paneer, add some cheese. So it will be highly satisfying, and at the same time, we can get rid of all the disease. And as Dr. Pran has always said, being a gastroenterologist, he has explained it very nicely why acidity happens. So reducing all these refined foods will actually help you get rid of acidity. No need to carry this antacid with you any longer. And don't worry, meat doesn't cause cancer as long as it is not a processed one, and as long as it is not fried in that junk oil. So please use good fat like butter and ghee, and we'll be all well off. So Dr. Pran, thank you very much for sparing your time, and connecting from Australia to India. So I'm sure that, we got a very different perspective in DLF this time by having a session with a gastroenterologist, having a very different view. So thank you, doctor. Thank you, Dr. Pran. And, I welcome you to India anytime. So
I'd love to meet up with you if I'm there in the future. And thank you for having me on your podcast. It's been a pleasure to talk to you about a topic very close to my heart, because obviously arising from the subcontinental region, this is a very dear topic to me, and it's heartbreaking to see what's occurring in India with the diabetes epidemic. I certainly wish people like you the best. You've certainly got a big job on your hands.
Thank you, sir. Thank you, Doc. Thank you.
No problems. Take care.